Assalamu alaikum respected doctors. Welcome to my YouTube channel MBBS and BDS lectures. Today is the second video of a rapid revision course of prosthodontics complete denture. Now today we will discuss about anatomical landmark of maxilla. Now for construction of best maxillary complete denture, first we should know the normal anatomical landmark of maxilla. Now today we will study this topic in a sequence. First we will study maxillary anatomical landmark which are labeled in this diagram. Then we classify these anatomical landmark into three categories: limiting structures, supporting structure, relief areas. Then we go back in this diagram. Again we will study these anatomical landmark by this diagram. Then we will study each landmark in detail. Now first a maxillary landmark. In number 1 there is a labial frenum which is marked by number 1. In number 2 there is a labial vestibule, and number 3 there is a buccal frenum. In number 4 there is a buccal vestibule, and in number 5 there is a distobuccal sulcus, and in number 6 there is a alveolar ridge. In number 7 there is a maxillary tuberosity. In number 8 there is a hemular notch. In number 9 there is a heart fillet, and in number 10 there is a fovea palatini. In number 11 there is a mid palatine suture, and in number 12 there is a incisive fibula, and number 13 there is a rugae areas. These are the maxillary anatomical landmark. Now we classify maxillary anatomical landmark into three categories. Number 1 is the limiting structures, which limit the maxillary complete denture. And beyond, we should not extend the complete denture borders beyond that areas, which is the limiting areas, which limit the denture extension. Second is the supporting structure. Supporting structure are that structure which support the denture, which resist the horizontal and perpendicular forces. And the third is the relief areas. On that area we should trim the denture. We should relieve the area in order to not compress these area which have glands, which have vessels, nerves. Now first, limiting structure. Now a limiting structure, per easy per easy understanding, we divide the limiting structure into three. First, interior limiting structure, then buccal, and then posterior. Now interior limiting structure are labial frenum. This is the labial frenum which is marked by 1. This is the interior limiting structure. Second is the labial vestibule, which is marked by number 2. This is the these are the two interior limiting structure. Now come to the buccal area. In buccal area limiting structure, there is a buccal frenum. There is a buccal frenum which is marked by number 3, and next is the buccal vestibule which is marked by number 4. These are the buccal limiting structure. Now come to the posterior limiting structure. In posterior limiting structure there is a hemular notch. Second is the posterior palatal seal. There is a hemular notch which is marked by 8 number. This is hemiolular notch. And when we move from 8 toward the mid area of the mid area of the posterior border of the palate, there is a posterior palatal seal area. Mean these are the limiting structure which divide into anterior limiting, buccal and posterior for easy remembrance. Second is the supporting structures. Supporting structure are those structures which support the complete denture, which resist the horizontal and perpendicular forces. Now, supporting structure we divide again into two, which are the primary stress bearing area and secondary stress bearing areas, or primary supporting area or secondary supporting area. Now, what is the difference between primary and secondary supporting structure or supporting area? Now, primary supporting structure are those structure which resist the perpendicular forces, and secondary stress bearing areas or secondary supporting structure are those structure which resist the horizontal forces. Now in maxilla there is the two primary stress bearing areas or primary supporting area and two secondary stress bearing areas. In primary stress bearing areas, number one is the posterior lateral slope of heart palate, and second is the maxillary tuberosity. These are the primary stress bearing areas. Now come to the secondary stress bearing areas which resist the horizontal process. These are the number one palatal rugae, and second is the crest of residual alveolar ridge. Now come to the relief areas. Relief areas are those areas on that area we should trim the denture in order to there is a no compression of that areas, because these areas have glands, nerves and blood vessels. Again, relief areas are three, and again for easy remembering we divide relief areas like limiting structure we divide into anterior, buccal and posterior. For easy understanding, for easy remembering, we divide the relief area into three. Anterior incisive papilla, which is present between maxillary central incisor slightly posterior. Second is the mid palatal rugae, which present in the middle, where the mid palatal suture are present of the heart palate. Third is the fovea palatini, which are present posterior extent of the palate. Now relief area we divide into again three: anterior incisive papilla, middle mid palatal rapi, and third is the posterior is the fovea palatini. Now come to this diagram again. Now interior there is a labial prenum, which is the interior limiting area. Next is the labial vestibule, which also the interior limiting area. Next is the buccal prenum, buccal vestibule, which is the buccal limiting area. Then come to the posterior limiting area. There is a hemiolular notch and notch and posterior palatal seal area. Now come to the supporting areas. Posterior lateral slope of the heart palate is the primary stress bearing area, and maxillary tuberosity is the primary stress bearing area. Now come to the secondary stress bearing area, rugae, where there is a elevation thickness of the mucosa over interior region of heart palate is the rugae. These are the secondary stress bearing area, and residual alveolar ridge also there is a secondary stress bearing areas. Now come to the relief area. Anteriorly there is the Um, incisive papilla, which is the relief area. In middle there is a mid-palatal suture and mid-palatal raphe, which present in the mid-palatal suture, and posteriorly is the fovea palatini. Now come to the detail of each structure. First is the labial prenum. Now, labial prenum is the single band of fibrous connective tissue. Remember, frenum is the connective tissue, fibrous connective tissue, band of mucous membrane. But always remember, prenum have no muscle fibers. Now, first is labial prenum, which is the interior limiting area, and it consists of single band of fibrous connective tissue. And is in that area, in complete denture, we also give relief, properly relieve that area. Mean we slightly trim the anterior region of complete denture to produce space for this labial prenum. Mean labial prenum is the anterior limiting area. Now come to the second anterior limiting area is the labial vestibule. Now labial vestibule is a region which extend from labial prenum to buccal prenum, which are present in the buccal area, premolar area. This space is called labial vestibule. Proper lip support should be provided. In that area, there is a proper lip support should be provided by complete denture flange. And the flange, the part of complete denture which come in the labial vestibule space, this is known as labial flange. And this labial flange should support the lip. Now come to the buccal frenum. Buccal frenum consists of one or more bands. Like labial frenum have one band, single band. But buccal frenum is slightly thick than labial frenum. It consists of one or more bands. Now again we should relieve that area and influenced by three muscle. Orbicularis oris muscle forward and buccinator muscle backward and caninus muscle effect on its position. Mean caninus muscle position affect influence the buccal frenum. Now come to the buccal vestibule. Buccal vestibule is the area from buccal frenum to hamular notch, which is the posterior limiting area of denture, complete maxillary denture. Now, buccal vestibule influenced by three muscle, buccinator muscle, modiolus muscle, coronate process of mandible. Now, the flange of complete denture which come in buccal vestibule is known as buccal flange. Now, next is the alveolar ridge. Alveolar ridge is the secondary stress bearing area. Now, residual ridge lift after the extraction of teeth. When we extract the teeth, the ridge remain is known as residual alveolar ridge. In residual alveolar ridge, mucosa is firmly attached to the periosteum of the bone, consist of dense collagenous fibers. Now come to the maxillary tuberosity, which is the primary stress bearing area in maxilla, and this is the maxillary tuberosity. And in combination syndrome, the maxillary tuberosity in maxillary tuberosity areas, the soft tissue are there is an extension overproduction of soft tissue on that area. This is the maxillary tuberosity. Now come to the hamular notch, which is a posterior limiting structure. Now hamular notch is a pterygomaxillary notch, distal extension of a denture. It is a distal extension of a denture. Meaning it limit the denture posteriorly. Beyond hamular notch, we should not extend the denture. Now, hamular notch help in identifying the posterior palatal seal area. Hemular notch situated between the tuberosity, mean maxillary tuberosity, and humulus of medial pterygoid fleet. This is the hemular notch. Now come to the hard palate. Now hard palate is the posterior lateral slope of the hard palate is the primary stress bearing area. Now hard palate are flat area. Hard palate flat area are secondary retentive areas, but hard palate posterior lateral area are the primary stress bearing area. Now hard palate is there are three types of hard palate: U-shaped palate, plate shaped palate, V-shaped palate. Now U-shaped palate is the best one, and flat palate is have not good support, and V-shaped palate are least favorable. I mean U-shape it is the best one. Now come to the fovea palatini, which is the posterior relief area. Now formed by coalescence of several mucous gland ducts. There are in fovea palatini region. What is fovea palatini region? It is formed by confluence of several mucous gland ducts. It is the landmark per location of vibrating line. Below that area, we find the vibrating line. It is the landmark per location of vibrating line. Now come to the, this is the posterior relief area. Now come to the mid-palatal suture, which is the middle relief area. It is the junction of palatine process of maxilla covered by thin mucus slightly elevated or raised. Properly relief required. In that area we should give relief. Mean by trimming the denture to provide space for that area in order to not compress directly that area. Next is the incisive papilla, which is the interior relief area. Now, incisive papilla is a fed up fibrous connective tissue over incisive foramen. Proper relief should be given in that area. Because there is a nasopalatine vessels, nerves, veins. Now, incisive papilla aid mean help in arrangement of anterior teeth and jaw relation, and also tell about residual ridge resorption. Now come to the rugae. Rugae is a secondary stress bearing area in maxilla. It resists the horizontal forces against the denture, should not be over compressed. Should not be over compressed. Now, this is all about maxillary anatomical landmark anatomical landmark of maxilla. Now, in third video, we will study anatomical landmark of mandible. Now, if you find this video helpful, like this video and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.